Welcome back. We've got today's checklist, and we're going to break down what we all need to do to take control of our health in 2024, from annual tests to visits and vaccinations. NBC News medical contributor Dr. Tara Narula is here to lay out our health checklist for the new year. Doc, good to see you.
Happy New Year.
Oh, Happy New Year to you. So a new year makes sense. A time to schedule that visit with the doctor, do the test, all that. So how do we start this off?
Right. So this is a great time for people to pick up the phone and call their primary care doctor. Why is the primary care doctor so important? Well, a lot of us have specialists, cardiologists, dermatologists, but nobody that's looking at the big bird's eye view of you, right? And what's going to be important to keep you healthy going forward. So I like to say the primary care is like the quarterback of the team. You can meet with them, talk about how do I stay ahead of the curve in terms of prevention with screenings and vaccinations. Take a look at your medication list. Lots of people walk around with medications they've had for years.
Right.
Some interact with others. So I usually say take pictures of your bottles, your supplements, and bring them in and go over your med list. It's a great time also to bring questions. So write down a couple questions you have, because when you get in the office, you usually forget.
Yeah.
And then it's really, I think, about building a relationship. Like with any relationship, when you want to be vulnerable, you need trust, and that takes time. So making that every year visit gives you time to feel safe, to open up about things that may be going on in your personal life that affect your health or other matters, and also for the doctor to get to know you. So when I see my patients every 6 months or every year, I can tell when something's off or something's different. So that's really for
So
me
establish a
part.
baseline.
Correct, exactly.
Thanks.
That's so interesting. You know how many people just go to the doctor and they just sit ready to receive? Do you know what I mean? As opposed to saying, especially you mentioned supplements. People are taking all sorts of stuff.
You want to be
should know.
proactive.
Yeah, that's
exactly.
good. All right, let's talk about knowing your numbers and some of the tests that we need to do.
So would you ever go on vacation and not know how much money was in your bank account? Would you ever get in your car and know how much fuel was in the tank? So it's really important to know your numbers, because that's what's going to keep you moving forward.
Good analogy.
Right? Okay.
All right.
So the numbers that you need to know: blood pressure, cholesterol numbers, blood sugar, and your weight or body mass index. So let's talk about a normal blood pressure is usually 120 over 80. Once you go over 130 over 80, that's high blood pressure. Cholesterol numbers, you're usually going to hear about 4. Total cholesterol, HDL, LDL, and triglycerides. You want your HDL, the good one, to be above 40 for men, above 50 for women. The LDL, the bad one, to be below 100 ideally. Total cholesterol below 200 and triglycerides below 150. Blood sugar. So usually a fasting blood sugar that's less than 100 is a healthy one. We also sometimes talk about a number called hemoglobin A1C, which is a marker of how well your sugar's been controlled over the last 3 months. That should be less than 5.7. And last, body mass index or waist circumference. A lot of us want to know, are we a healthy height-weight ratio? That's your BMI. If it's between about 18.5 and 25, that's healthy. Waist circumference for women, less than 35. For men, less than 40. The American Heart Association has a great tool called the My Life Check. You can go on and you can get a sense of what your heart score is. We know that CVD,
you plug in the numbers and it tells you the health of your heart.
It'll walk you through, yes, and it'll give you tips for how you can keep yourself healthy. And then one more number, Chanel, the phone number to your family members. Why? Because your family history is really important. So call them up and know what your risk factors might be.
Good. All right. Before we get to cancer screenings, I want to say anybody who really needs them needs to call today, because it could take months to schedule an appointment.
My sister-in-law over Christmas holiday just told me that it's basically a 10-month wait for her colonoscopy.
Yeah.
10 months.
I waited 8 months to get a mammogram appointment for this week, but it's my first one because I'm in that age group now.
Correct. So screenings are so important because we have great treatments for cancer, but you got to get to things early, right? So let's talk about the 4 most important ones that we focus on. So cervical cancer, you can see for women, should start around age 25 with an HPV test or pap test. Breast cancer screening. So women should have the choice to begin annual mammograms at age 40. Absolutely by age 45, they should be doing their annual mammograms. Colon cancer, for those who are at average risk, usually you start your colonoscopies at 45 or above. And then last is prostate cancer. You can talk to your doctor about getting screened once you're over 50. But if you're African American, or if you had a family member who had prostate cancer, father or brother, before 65, you might want to start screening earlier. And again, all of these depend on really your own risk, too, and your family history. Yeah.
All right, let's from screenings to vaccinations here, Dr. Narula. What are some of the routine vaccinations that we should all be getting right now?
Right. So this is all going to depend also on your age, your health status, job, travel, all of that. But in general, you can think about it broken down by age. So if you're basically 19 to 49, you want flu, you want to be up to date on flu, COVID, MMR, something called Tdap or tetanus, diphtheria, and then COVID. Sorry, flu, COVID, MMR, Tdap. Those are kind of the big ones. ones, and hepatitis B. Once you're over 50, then we think about shingles. So that's another one to talk to your doctor about. When you're over 65, pneumonia, you want to get vaccinated for pneumonia. And then RSV is our newest one that you can have a conversation with your doctor about starting over the age of 60.
All right. Last but certainly not least, we spent a lot of time talking about our physical well-being, our mental well-being. Oh, we're going to use the same panel. My mistake there. Mental health.
This is so important.
Yeah,
I mean, we can't talk about this enough. And I just had a conversation in my office yesterday with someone saying, I can't really address your heart issues until we address what's going on up here, right? So it's so important to focus on how somebody is doing mentally. And that may mean seeing a therapist.
Yeah.
This is a great time, again, because of the long waits to pick up the phone and call and get plugged in. Mindfulness, there's lots of great apps we can use. And then social connectedness. So one of the best New Year's resolutions would be to connect with your family members, friends, join a group. We know that loneliness is a big risk factor for
especially as you get older.
Absolutely.
Going back to what Dylan just said, do we know why it's taking so long for folks to schedule routine screening?
It's not so much it's backup, a lot of it from COVID still, unfortunately, that everybody's now starting to get these tests. But those waits are really incredibly long. So
crazy.
Important to make those calls today.
Thank you, Dr.
Thank you. Very good information this morning.
Hey, thanks for watching. Don't miss the Today Show every weekday at 11 a.m. Eastern, 8 Pacific on our streaming channel, Today All Day. To watch, head to today.com/allday or click the link right here.